PGE2 regulates the plasminogen activator pathway in human endothelial cells, the difference between normal and heavy menstrual bleeding women. I'm Saif Sadek, a reproductive endocrinology fellow at the Jones Institute. Increased endometrial tissue plasminogen activator concentrations and plasminogen activator 1 activity are found in women experiencing heavy menstrual bleeding. It is unknown which cell compartment is the source of the increased activity of this plasminogen activator system. There is a dissociation with greater increase in TPA to pi1 ratio in the endometrium of women with heavy menstrual bleeding. To our knowledge, we were unable to find any published evidence that prostaglandin E2 or its receptors affect the human uterine endothelial cell plasminogen activator system. The menstrual effluent of women experiencing heavy menstrual bleeding has both increased fibrinolytic activity and prostaglandin E2. These findings support the concept that PGE2 acting through one or more of its receptors has the potential to alter the plasminogen activator system, resulting in heavy menstrual bleeding. This is the first investigation looking into the role of PGE2 on TPA and pi1 in human endometrial endothelial cells from women with normal menstrual bleeding compared to those with heavy menstrual bleeding. Our primary hypothesis is that PGE2 will significantly increase TPA and pi1 concentrations in the human endometrial endothelial cells. Human endometrial endothelial cells were established from both groups of women. They were then cultured with prostaglandin E2 at 3 concentrations. We used ELISA to assess the concentration of pi1 and TPA in the media, and the total protein was extracted from the cells and determined using the BCA assay. Differences among experimental groups were analyzed using a repeated measures one-way ANOVA and an unpaired t-test. Significance was defined as p is less than 0.05. There are no differences between patient demographics, peripheral clotting factors, menstrual fluid, peripheral levels of pi1 and TPA between both groups. The average age in normal menstrual bleeding women was 38.8 and heavy menstrual bleeding was 42.8. Heavy menstrual bleeding women had at least one fibroid by ultrasound. Pi1 was significantly increased in normal menstrual bleeding women at both 10 to the minus 7 and 10 to the minus 9 molar concentration of prostaglandin E2. There was also a dose-dependent response to PGE2. There are no differences in pi1 levels in heavy menstrual bleeding women at all concentrations. pi1 control levels were significantly higher in heavy menstrual bleeding women compared to normal menstrual bleeding, by almost 200%. And PGE2 had no significant effect on TPA in both normal menstrual bleeding women and heavy menstrual bleeding women. An increase in pi1 is associated with a decreased fibrinolysis, leading to a shift in the relative ratio of pi1 to TPA. This shift of balance between pi1 and TPA governs the amount of free TPA and its activity and fibrinolytic potential, and in turn stabilizing blood clots in the endometrial of normal menstrual bleeding women. We've shown for the first time in the literature that PGE2 alone has a direct effect on the human endothelial cell plasminogen activator system, resulting in a statistically significant increase of pi1 concentration. Specifically, PGE2, 10 to the minus 7 molar concentration, increased pi1 by approximately 315%. This finding represents the first piece of evidence of PGE2's direct involvement in abnormal uterine bleeding. The lack of pi1 response to PGE2 leads to more fibrinolysis in heavy menstrual bleeding women compared to normal menstrual bleeding, preventing endometrial clots from stabilizing, potentially leading to an increase in menstrual blood loss. In contrast, normal menstrual bleeding women responded to PGE2 with increasing levels of pi1, theoretically leading to stabilized clots in vivo and decreased menstrual bleeding. This is the first study to show that endothelial cells isolated from the endometrium of heavy menstrual bleeding and normal menstrual bleeding women retain some phenotypic changes in their plasminogen activator system. Identifying this pathway is the first step to a potentially new therapy for menorrhagia.